Well, what we're seeing is the incidence of malignant melanoma, amongst other skin cancers, but the most deadly type of skin cancer, melanoma, increasing by up to 800% in women age 18 to 39.
Back again. This time we're joined by Dr. Wendy Sadoff. Dr. Sadoff, thank you for joining us.
My pleasure.
Appreciate it. We've been talking about sun protection and the importance of it. I mean, what do you think? Why do you think it's so important for us to protect ourselves from the sun? What's the importance?
Well, what we're seeing is the incidence of malignant melanoma, amongst other skin cancers, but the most deadly type of skin cancer, melanoma, increasing by up to 800% in women age 18 to 39. So these young adults with an incidence of melanoma that's increasing, and we're very concerned about that. It's the deadliest form of skin cancer, and we think that it is related to the change in behaviors. In other words, going and having indoor tanning is one factor that we're very concerned about.
As well as, protecting yourself from the sun, obviously. An important factor, so again, we've talked about before, that it's important to have maybe young people even and talk to them about the exposure to sun and damaging and the aging process accelerated. But now we're talking about another factor, melanoma, the deadliest cancer, and it seems like the risk is increasing. Are we making any headway though?
We definitely are, and some behaviors have changed. I mentioned the behavior I'm not in favor of, which is indoor tanning. But other behaviors have improved in terms of protecting your skin with sunblock, and the products that we have available to us have improved. So those are good signs.
And the products, meaning the sunscreen you're talking about?
Right, sunblocks.
And how have they improved? Is it the broad spectrum of protection?
Yes, well, there's a lot of misunderstanding about sunblock, and I think it's overwhelming. You go into the drugstore and you see so many products, and the only thing people really gear in, focus in on is SPF, and you have to understand what SPF really means. It's an agreed upon rating for ultraviolet B protection. But the sun doesn't just come down as ultraviolet B rays. There are ultraviolet A rays in the spectrum as well, and those are longer wavelengths of light. Those are responsible for skin cancers and for sun damage and aging of the skin. So the B rays, although they're responsible for that burning, and we certainly want to prevent burning, sunburns, we really have to have a broad spectrum sunblock. And so you can look for number, then you can look for broad spectrum, and then it's even more complicated.
Sure.
Because some sunblocks, even though they're broad spectrum, the A protection may wane with time, so you end up that although the B protection may be a 70, the A is not anywhere near that. And there's not an agreed upon rating for an A.
Oh, that's tricky. So, there's been some advances in the protection, but what you're saying is that it's difficult to discern. Well, the best thing I think would be take it to your dermatologist and maybe show them and see what's going on. I mean, and you would be able to tell, hopefully, because and how can you tell? I mean, can you give us some tips about how people can look, if they can, and maybe figure out for themselves what the best protection from A is?
I think people should come in and they should have a skin exam so that we can look at areas of their body that maybe have developed the signs of chronic sun exposure or overexposure. We should have a discussion about what their sun behaviors are. Do they really want to go out and get a tan, or is it just that they're outside a lot? Are they running during the daytime, and as athletes are getting some sun exposure? And really come up with the proper sun protection regimen. Right. It might be a sport formula. It might be something very lightweight. It might be a spray. It might be a zinc oxide product, which I'm really in favor of. I like zinc oxide.
Zinc oxide, yeah.
Well, zinc oxide is really what we would call kind of a chemical-free type of sunblock. And we're all familiar with the Lifeguard and the white nose years ago.
Yeah.
That's zinc oxide. But of course, back then it was thick and white, and it basically just physically blocked the sun. So it blocks everything. It doesn't block just A or B. It blocks all the rays. And it's great, but it's really thick and difficult. We would call it not so elegant in terms of application. But over time, those products have gotten much, much better. And there are products that are almost clear or invisible that are zinc oxide. So,
and you recommend that?
Yes.
So a good tip that the doctor is saying is that you maybe use zinc oxide and along with getting some sun protection. As a nation, it seems like, you know, we are at least trying to say that this type of protection is important. Do you see that happening in our community and our nation?
Certain areas are better than others. Certainly as a nation, we are behind other nations like Australia, where they have such a high incidence of melanoma, and they have tremendous sun protection programs for their young children. And so we're behind overall as a nation. And within, there are communities that do better than others. There are some recreational parks that have sun shelters. I think it's kind of mixed, but there's still a lot of misunderstanding about the sun. People will think, you know, if they are not going out to the beach to lay in the sun, they don't need
protection.
Sun. Right. And we've done studies where we've looked at people who say, I don't get any sun. I'm never in the sun. And of course they are. They're driving and the ultraviolet A is coming through the window.
Right.
They might stop and have a long chat in a parking lot or eat lunch outdoors. They're actually...
It all accumulates, doesn't it?
Yes, and even just that small amount over time really is damaging.
Yeah, so important advice. You know, we heard from our patient previously, or our sun protection patient, you know, came and said, she uses it all the time, even in the wintertime. She wears sunglasses. And you're absolutely right. People think that, you know, that just because you're not laying out in the sun, that you're not damaging your skin, but you in fact are. And it's interesting how much damage you can get. We have to take a break. More with Dr. Sadoff when we come back. Please don't go away.
You want to have a broad spectrum sunblock. I would not rely at all on any SPF in foundation, in any makeup, or even in moisturizer.
Welcome back, and thanks for staying with us. You know, we have Dr. Sadoff. When we left, we were talking about sun protection and protection from skin cancer, as well as some of the damaging effects of the sun on your skin. Now, let's say you do have some damage to your skin. Is all damage irreversible, or can something be done about that?
There definitely is the ability to reverse some of the damage that's done, and actually our bodies have an innate repair mechanism going on. Just like we have an immune system that fights infections, we also have our system that goes and repairs damaged DNA. So the critical thing is to prevent further damage and allow your system to repair what you have. In addition, there are some topical agents where there is some science that they can repair some DNA damage. So that would be a question for the dermatologist. You know, is something like that appropriate for a patient?
And so if you have any damage, see your dermatologist and understand that, first of all, prevent further damage from happening. Secondly, are there any topical lotions that you can use? So great advice. How often should we, you know, for those of you watching at home, how often should we examine our skin for signs of damage?
I would say a general rule is once a month.
Okay.
It's an interval that people can remember. They do other things every month. They can just link this to that, and they're more likely to do that. And then once a year to see your dermatologist. And after that, as you know, depending upon what damage is there or what the risk factors are for skin cancer, you know, just determine an interval for going into the doctor. But at home, once a month.
Perfect. And if you're somebody who's single, you know, if you're married or have somebody significant with you, you know, it's easier to watch your back. How do you, if a single person, how do you recommend they examine themselves? I mean, do you have any tricks?
That's a great question. Good reason to meet someone, right?
In order to get an exam, please find someone.
Cut that part. There is a card that I actually have in the office that shows how, with a mirror, one handheld mirror and then like the other mirror in the bathroom, how you can really see the back of your thigh, you know, all these areas that are tougher to see. So there are very few areas that will be missed. Then there are areas, though, that are difficult in terms of like your scalp. That would be difficult for someone. But I always say, wherever you are that someone's looking at that part, whether you're at the hairstylist or you're having a massage,
That's a great point.
Someone's looking at an area that you may not be able to see regularly.
And ask them.
Ask them, tell them you're comfortable with them letting you know if they see anything.
That's a great tip. You know, sometimes you don't look at certain areas that much, and if you have somebody who sees you regularly, ask them, has anything changed? That's an important tip. Not Jody, you know, who was here before. She had a great regimen, and she was using SPF 100. I mean, first of all, tell us about her regimen. Does everybody have to follow her regimen?
No, not everyone, and the SPF 100 can be a little tricky. Again, there may be a great product that's an SPF 100, but SPF, like I said, is a limited piece of information.
With the UVB protection you're talking about.
Right. You want to have a broad spectrum sunblock. I would not rely at all on any SPF in foundation, in any makeup, or even in moisturizer. So when people say, well, it's a 15 or it's a 30 in my makeup, I would disregard that as if that doesn't even count. That's usually, you're not applying your makeup thick enough to get that kind of protection.
I see.
And it's usually not a broad spectrum.
Even foundation?
Foundation, we don't apply it thick enough to get that kind of protection.
I know a lot about foundation after this show.
Maybe your foundation.
Maybe mine.
But so I, in general, don't assume that you're getting anything significant at all with foundation, but she is also using sunblock on top of that. There's one other thing she said that I just want to comment on. I think she's amazing, and she's so aware of every area to protect, and she's been doing it from a young age and using protective clothing and
sunglasses, all of it.
Perfect. The sprays, some of the sprays you have to be careful about because they really, in order to get the protection that is intended, it's a spray rub like 3 times in order to really get that level of protection.
The spray sunscreen you're talking about.
With the exception of a zinc oxide spray that's newly out, and that's a different story, and that's a great product.
And what about her contention that it's, I'm sorry to interrupt you, but that it's faster? She doesn't like the 20 minutes, I mean, as much, obviously, but I mean, is it faster?
I think that sunblock has to be practical, and speed of application is key. So I do like the zinc oxide aerosol spray. But the others, maybe have them as an additive, not just the only sunblock that you're using on your body. Maybe something for reapplication because it's quick and you're there and it's cooling when you put it on. But in general, if you're doing a spray, it would be added to another sunblock or the zinc oxide aerosol.
And is that available anywhere, the zinc oxide spray?
The one that's out now is only available through dermatologists.
Okay.
But there may be some additional products coming out as well.
Pretty expensive or no?
It's interesting because you did mention expense to her, and you don't need to spend a lot. As a matter of fact, I wouldn't go to the department store to buy your sunblock at all. And at the drugstore, they're about $15 to $20, and sometimes at a dermatologist might be $20, $25, so not that much different. And you don't need to spend a whole lot, but it is a decision to invest in a good sunblock.
And the zinc oxide, you said about 20, is that what you said? Or how much?
It can be about 20, 25, some of them, but not too much different than the drugstore price point.
For a lot of us who are at home, I mean, how long would that last, the $20? I mean, would it last a month or 2 weeks? Or?
Well, if it's just a product for your face, it's going to last over a month.
Okay.
If it's a product for your entire body and you're out all day, it's going to go more quickly. And she mentioned reapplication being key, so is the amount that you put on. And the reason why I don't like a product that's too expensive is I don't like someone to be, really skimping, thinking that they don't want to go through it. So I think,
great tips, great tips. I appreciate it. We have to take a break. When we come back, we'll take some questions from our studio audience. Dr. Sadoff and I will answer them. Please don't go away. Thank you.
So it's not where we used to think we buy our bottle and we have it all summer long.
Right.
No, you have a basket of all different types of sunblock for different purposes.
Nice to have you back again. Now it's time to answer some questions from our studio audience. Dr. Sadoff, are you ready?
I'm ready.
All right, let's do it. Yes, sir.
Hi.
Hi.
As an African American, is sunscreen with a rating of SPF 30 adequate enough for me?
It's a great question. Dark-skinned people like myself too, I'm Indian, and number one, is that SPF 30 adequate? And also, is sun protection as important? Add to his question, is sun protection as important for me and an African American as well? Is that a big deal for us, or should we just leave it alone because we have natural protection?
Well, you are less likely to burn That's one thing. But I would say that wearing sunblock on a regular basis is important. You may not be as likely to burn, but another factor in terms of the sun exposure is the blotchiness that can arise. And that's a very difficult thing to treat. So you don't want to have dark spots and irregular coloration on your skin. And I would say, yes, even in darker skinned individuals, still wear sunblock and examine your skin. There are some skin cancers that are more likely in darker skinned individuals, a type of melanoma that's more likely to be found on fingers, toes, ears, nose, those places. So skin exams, self-check, and sunblock still important.
And the question that I added on was, meant to show that some people feel that, and that I'm dark skinned, I don't really need any protection. In fact, you do, like you talked about the melanoma, and we still are prone to get sun damage, and so it's deceptive what could happen. So yes, sun protection is as important for us as well, and there are many people watching who are, the same skin color as myself or the gentleman who asked the question. So great question. Yes, next question. Hi.
I've heard that applying too little sunscreen can be worse than applying none at all. Is this true?
Well, that's a great point. We talked about before that you should apply adequate amounts of sunscreen. Now, what she's asking is, can it be worse than not applying any at all?
I would say no. I'd rather you apply a good amount in order to get the full protection. But for a given amount of exposure, in other words, for a given amount of time, any amount of sunblock is better than no sunblock at all. So it would be like, is protecting with a short sleeve shirt not as good as protecting with long sleeves? Yes, but it's better than protecting with no sleeves. So it's, anything is better, but what we want to make sure that a person's not doing is that they have a little bit of sunblock and then they're staying out longer than they should or whatever. But
there's a myth about this, though, isn't there? That if you put a little bit of sunblock, can there be production of some damaging free radicals or anything is that just the old wives' tale then?
Well, I think there are a lot of things raised, like, is sunblock dangerous at all? And I would say certainly not dangerous like the sun's rays are, and I think there is abundant evidence that sunblocks are safe. But if there is concern over some chemicals in sunblock, the zinc oxide eliminates that concern.
Well, that's a great tip. So first of all, there's no convincing evidence that this too little sunscreen actually does anything. But in fact, if you're concerned about that, that's a great tip, that zinc oxide actually does it. And the spray is fine, and in addition,
the zinc oxide spray, I like that. And then, of course, all the other ways of protecting your skin with the clothing and the hat and sunglasses and shade.
And we can't forget about that. Now, are there any other forms of zinc oxide that you like, or just the spray?
No, I like the spray, the creams, the gel. I like it all.
Oh, and which is the easiest? Does the spray is easiest to get?
Spray is easiest, fastest for the whole body, but it's not going to be, you can't use it on your face. So that brings up that you really need a collection of sunscreens or sunblocks. You might need something certainly for the lips in a stick formulation. You're going to need a spray maybe for the body. You're going to need a sport formula. So it's not where we used to think we buy our bottle and we have it all summer long.
Right.
No, you have a basket of all different types of sunblock for different purposes.
And if someone's on a budget, and as quickly as you can, because we don't have a lot of time, what should they do about the zinc oxide? They need different formulations. If you had to pick one form, would it be the spray?
I think the spray would be great. Or you can go to the drugstore, look at percentages of zinc oxide and, feel the formulations. But a lot of it is that you have to find a product that you'll use. So even the best, most protective product isn't going to work if you really hate the feel of it.
And if you don't use it. That's a great point. Next question. Yes, sir.
Yes, are there tanning beds that are safer than being out in the sun?
I think that, the short answer is probably going to be no, but I'll ask Dr. Sadoff, what do you think? Are there any safe tanning beds out there?
None.
Yeah.
As a matter of fact, there should be certainly
law against them, huh?
I'm pretty passionate about restrictions in terms of tanning beds, and in terms of younger individuals, but it is not safer. It can be more dangerous because people have this false sense that
of security.
It's indoors. They're getting the rays indoors, but they are getting an intense dose of ultraviolet radiation on their skin, and oftentimes not protecting areas well, like their eyes or other areas.
We have to take a break. When we come back, more with Dr. Sadoff, and we'll both answer your questions. Thank you very much.
Do spray tans have any dangers, and how often can someone get a spray tan?
Thanks for coming back. When we left you, we were answering some questions rather from the studio audience. And are you ready, Wendy?
I'm ready.
Perfect.
Hi.
Yes, hi.
Do spray tans have any dangers, and how often can someone get a spray tan?
Well, that's a great question. You know, with all the dangers that we have of tanning booths and tanning beds, spray tans, what do you think about that?
Well, I would much rather you go get a spray tan than try to achieve that bronzed look by going out in the sun or going to the tanning booth, as we talked about earlier. That being said, that is a chemical being sprayed on your skin, abbreviated DHA. It's a chemical that the FDA has said is safe, but there are some precautions I would advise taking.
Sure.
I would say I wouldn't want you to inhale it or have it near the eyes, nose, or mouth, because it's really just to attach to the most outer layer of the skin and then cause darkening. So I'd much rather prefer that. But in terms of how often and how you do it, there's a larger percentage of that chemical, DHA, in the modern spray tan than there is in the lotions that you would use at home. So if you are concerned about the chemical, and some studies that were done, these are animal studies, then you would use the lotions with a lower strength. And also, then it's not aerosolized, it's not in the air to inhale it or get it near the eyes or nose. So
But tell them about the dangers. I'm sorry to interrupt you, but tell them about the dangers of why you're worried about the eyes or the nose. Tell me.
Well, there's more absorption. So if we don't understand all that may be
you don't want that to go in your body.
Exactly. So keep it just on top of the skin. It attaches to the outermost layer, and use the lotions maybe more than the modern spray tan store or spray tan
Absolutely.
salon, and also maybe mix it up with bronzers or other ways to kind of keep that look.
Perfect. And so great advice. You know, the bottom line is better than going to a tanning bed, but still could have some dangers. We don't know a lot about this, unfortunately, because we're just learning more about it. So great advice, if you need to maybe use lotions instead of the spray tans that we talked about, and enhancers. So great point. Yes, hi.
Hi, doctors. I have to watch my vitamin D levels, and I'm concerned that if I apply too much sunscreen, I might minimize the absorption of vitamin D from the sun. Is there a concern about that?
That's a great point, because we need vitamin D. It's an essential vitamin. And what happens when you put the sunscreen? Does it change? Because you need some ultraviolet radiation to actually convert the vitamin D to a form that you need in your body. So how do you reconcile that? On one hand, you want the vitamin D, because you need it as a nutrition. On the other hand, you want to protect yourself from skin cancer. This is kind of a problem.
Well, there's no proof really that use of sunblock results in lower vitamin D levels. And if you look at people in regular urban populations that are not near the equator, there's a huge percentage of us that are vitamin D deficient.
Sure.
And I don't advise going out in the sun and exposing yourself to a known human carcinogen to get that vitamin D. So vitamin D is easily measured in the blood. Find out first whether you're deficient or not, and then it's something that you can take safely by mouth as a supplement. So I often will tell my patients who really think they need to get a lot of sun to get some vitamin D activation, I kind of analogize. I say, if there was something really good in cigarette smoke, that we found one good thing in cigarette smoke,
point. Would you smoke?
we wouldn't say, just take 2 cigarettes a day.
Yeah.
We would isolate that good chemical and supplement with it. So again, we wouldn't expose ourselves to a carcinogen to get one valuable
That's a wonderful analogy, and the idea is that absolutely you wouldn't try to have a carcinogen to try to get a potential good effect. And the key is that there's different types of vitamin D, and we've talked about this in other shows. Vitamin D3 is the one that your body can convert and make available in the skin, and you can get that from fatty fishes. You can eat a little bit more salmon, maybe. You can eat other fatty fishes and try to make up for that. We have other ways of getting vitamin D, so there may be a concern, but if you have an alternative, why risk skin cancer? I mean, I think the dermatologic societies have been pretty clear in making their position and saying that try to really avoid any unprotected sun exposure because of vitamin D. So it's a great question, because that's an important topic. Yes, you have a question?
Hi. Are there any medicines that can make the damage from the sun worse?
Well, that's a great question. So how about potentiating the sun's damage? So even accelerating it. Are there medicines that she has to worry about?
Yes, and many that I use in my patient population. So I use a group of medication, the tetracycline group of antibiotics for acne, and those can be very some of them more than others, but some can be very sun sensitizing. So there are ways to get around that. First of all, you make sure the person has good sun avoidance behaviors.
Sure.
But in addition, if it's a daily medication, oftentimes you can take it more towards the evening so that it peaks in your bloodstream when you're not out in the sun. It'll peak during the night, as opposed to taking it in the morning when most people are used to taking medications and having it peak right during those peak ultraviolet exposure times.
The 10 a.m. to 4 p.m.
Exactly.
Perfect. And and so if you get educated and understand what medicines can harm you, you can work around it. Now, what happens if you're somebody who's working outside? What do? You just cover yourself up as much as possible, right?
We have a lot of patients who work outdoors, and I think it's important to know what exactly their work is, because it may be that a certain type of hat is more practical than another, or they can maybe cover up more, or they can break it up during the day. So the more you have a conversation with the dermatologist about what your occupation involves,
Sure.
and also what your recreational hobbies involve,
It can help you.
you can figure out a way to minimize your damage.
Perfect. Thank you for taking the time, Dr. Sadoff, for answering all those questions. I really appreciate it.
My pleasure.
When we come back, Partha's Prescriptions. Please don't go away. Welcome back, and thanks for staying with us. Now today, we've been talking about sun safety. What can we take away on today's Partha's Prescriptions? Number one, be proactive. Protect yourself from the sun to prevent damaging and dangerous effects in the future, including skin cancer. Number two, avoid the sun between 10 a.m. and 4 p.m. when the sun's rays are strongest. Number three, when out in the sun, wear sunglasses, dark clothing, and a wide-brimmed hat. Number four, when using sunscreen, use one with broad spectrum protection with an SPF of at least 30. For more information on sun safety, please visit our website at www.askdrnandi.com. Also, you can join the discussion on our Facebook and Twitter pages. Just ask Dr. Nandi. Lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. Thank you for watching, and see you next time.